Hi, my name is Joan Pittman. I am a clinical assistant professor at University of Maryland and the co-chair of the clinical concentration.
Hi, my name is Michelle Tooten. I'm an assistant professor in the School of Social Work and co-chair of the clinical concentration.
The clinical concentration provides students with skills and knowledge to provide treatment to individuals, groups, and families in a wide variety of settings. And it prepares social workers for licensing exams, which open up many job opportunities. You'll be prepared to take the Licensed Graduate Social Work exam in the last semester of your MSW program, and then with additional supervision after graduation, you could sit for the Licensed Clinical Social Work exam, Clinical, and our clinical concentration prepares you for both of those exams. In fact, statistics from the Bureau of Labor project an increased demand for clinical social workers. I have been a clinical social worker for 20 years and have worked in many different settings. I've provided individual counseling for children that experience sexual abuse, provided family therapy to help families reunify, facilitated anger management groups in schools, conducted assessment and short-term treatment in employee assistance programs, and provided cognitive behavioral treatment to individuals with depression and anxiety. I've worked in schools, large nonprofits, outpatient counseling centers, and private practice.
My work in the social work field over the past 20 years has focused really on the treatment of substance use disorders, almost exclusively. Over my career, I've provided direct substance abuse treatment, directed a substance abuse treatment program, and I've designed and implemented interventions for individuals with substance use disorders through clinical research.
So Michelle and I's paths are just a couple examples of what you could expect as a clinical social worker, but there are many more. In the clinical concentration, there are two required courses that all the students take. These are Paradigms of Clinical Social Work and Psychopathology.
Clinical students in the program are able to choose one of 4 specializations: aging, behavioral health, families and children, and health. And students then take advanced clinical methods classes that help them to develop the knowledge and skills related to these specific areas. And because we're a large school, we have diverse faculty interest and can offer a broad range of advanced methods courses that focus on various populations, types of interventions, and treatment settings so that students can really tailor their educational experience. For example, in terms of client populations, we offer courses that focus specifically on women, children and adolescents, aging individuals, individuals with serious health or mental health conditions, individuals with substance use disorders, LGBTQ populations, and military service members and veterans. Field is also a critical component of the MSW education because field is where clinical knowledge and skills are actually applied. We provide in the program field placements at over 400 practice settings, including settings such as inpatient and outpatient behavioral health clinics, healthcare settings, the Veterans Administration, child welfare settings, various nonprofit programs, court systems, employee assistance programs, and school settings.
So thank you for listening to some information about the clinical concentration, and Michelle and I will be around campus and open to answering any other questions.